हेलो एवरीवन। आज हम स्टार्ट करने जा रहे हैं स्टर्नोक्लाविकुलर जॉइंट। फर्स्ट ऑफ ऑल, जॉइंट which type of joint? Synovial joint of saddle variety. Note: compound joint. So, as there are three elements taking part in it: the medial end of the clavicle, the clavicular notch of the manubrium sterni, upper surface of the first costal cartilage. Okay. Complex joint, as its cavity is subdivided into two compartments: supromedial, infralateral, separated by intra-articular disc, articular surface, clavicle. So basically, articular surface is concave convex shape, and the first clavicle covered with fibrocartilage. Surface convex from above downwards, slightly concave from front and back. Sternal surface is smaller than clavicular surface. It has reciprocal convexity and concavity because of the concavo-convex shape of the articular surface. The joint can be classified as saddle joint. And we have three types of ligaments: capsular ligament, interclavicular ligament, costoclavicular ligament. So why this joint is called compound and complex joint? Because it has medial end of the clavicle, this is the medial end of the clavicle, and the clavicular notch of the manubrium sterni. This is the manubrium part of the sternum, and upper surface of the first costal cartilage. This three part forms the compound joint, which you can say more than three elements taking part to form compound joint. Okay. Complex joint, as it has two compartments: superior medial and inferior lateral, divided by intra-articular disc. So here you can see this is the complete articular disc, which divides into two compartments: superior medial compartment and inferior lateral compartment. Okay. So first, capsular ligament. So we have to discuss the capsular ligament. It is attached laterally to the margin of the clavicular articular surface and medially to the margin of the articular areas on the sternum and on the first costal cartilage. The main bond of union at this joint is the articular disc. Note: the disc is attached laterally to the clavicle on the rough area above and posterior to the articular areas for the sternum. Inferiorly, the disc is attached to the sternum and to the first costal cartilage at the junction. Anteriorly and posteriorly, the disc fuses with the capsule. Second, interclavicular ligament passes between the sternal end of the right and left clavicle, some of its fibers being attached to the upper border of the manubrium sterni. So this is the interclavicular ligament and passes between right and left clavicle. Okay, and it is being attached to the upper surface of the manubrium sterni. So next is costoclavicular ligament, attached above to the rough area on the inferior aspect of the medial end of the clavicle. Inferiorly, it is attached to the first costal cartilage and to the first rib. So here is the costoclavicular ligament, which is attached to the inferior aspect of the sternal end of the clavicle, and inferiorly it is attached to the first costal rib and the first rib. Okay. Blood supply: internal thoracic and suprascapular arteries. Nerve supply: medial supraclavicular nerve. Movements which are held in this joint is elevation, depression, protraction, retraction, anterior and posterior rotation of the clavicle, which is utilized in overhead movements of the shoulder girdle. Thank you for watching this video.